So let's bring in Dr. Bharat Punkania. He is an epidemiologist and a senior clinical lecturer at the University of Exeter Medical School. He joins us via Skype from Bath in the UK. Dr. Punkania, thank you very much for your time. So look, we're seeing many countries like South Africa, Bangladesh and Australia go back into lockdown to try and fight the Delta variant. How worrying is this, and what's it telling us about how dangerous this variant is?
It's extremely worrying, and it is a clear signal that with runaway infections in many countries, you will get rise of variants. And then these variants, like the Delta variant, are much more infectious than the original Wuhan SARS-CoV-2 virus. So what we've got to do is suppress the infections and suppress it globally. And the only way to suppress it globally is by vaccination. And unfortunately, we also know that the vaccines are not available in poorer parts of the world.
And even the World Health Organization is warning that the Delta variant has the potential to make the epidemic curve exponentially. Is that because more global transmissions means more variants and a higher level of contagion?
Indeed, yes. So it's more infectious, and more infections equal more people ill, and of course, the emergence of other variants after the Delta variant.
And Bharat, it seems to be that younger people are mostly becoming infected by this Delta variant. Why is that? Is it because many are still yet to be vaccinated?
You got it? It's multifactorial. One is that they're still to be vaccinated in the UK, but the other bit is they are the ones who are more mobile and interacting with each other, and of course in schools, colleges and universities. So it is not at all surprising, the UK picture, that we have younger people getting infected and then they spread the infection to the other age groups.
And as we see more of these dangerous variants evolve, I mean, you touched on this earlier, how should the world be responding? I mean, is equitable vaccination the only way out of this?
It has to be equitable vaccination, as well as enabling different regions of the world to also set up manufacturing capacity, relaxing the patent laws, because we are going to need these vaccines, and we're going to need to have reformulated vaccines to cope with the variants. Therefore, it is important that manufacturing capacity in many parts of the world are enabled. It really is important.
Just a final thought to you, Dr. Punkania. What more can you tell us about the Delta Plus variant that's now beginning to emerge? What is that?
Yes, so we hear that, you see, these RNA viruses mutate, they make mistakes, so it's not surprising we have a Delta Plus. We do not know as yet if it is vaccine bypassing or if it is more severe disease causing. We will know in time, but we do know that it is more transmissible, more than the Delta variant. So it is again concerning that we suppress infections and stop the emergence of variants.
Dr. Bharat Punkania, always good to get your thoughts. Thank you very much indeed for talking to Al Jazeera.
Thank you.